Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having a really tough time with my health lately. I'm especially worried about these Parkinson-like symptoms that started appearing a few months ago. It's been getting progressively worse. I first noticed my handwriting getting very small, and now I move much slower than I used to. It's been really frustrating and sometimes scary.
I see. Can you tell me more about any changes in your walking or balance?
Yes, walking has become a challenge. I've noticed my steps have become shorter, and I'm just not as steady on my feet anymore. There was this one time I nearly fell while getting up from the sofa because I felt dizzy all of a sudden.
It sounds like you've been going through a lot with your mobility and balance. How about your neck pain? You mentioned it has been persistent since the accident.
The neck pain has been a constant issue. Yes, there's this heaviness behind my ear, almost like there's a plate there, though the MRI didn't show any metal. The pain hasn't subsided at all, and it's affecting my sleep and activities.
I understand. Have you noticed any other new symptoms recently? Perhaps related to your vision or swallowing?
Actually, yes. My vision has gotten blurrier, and just last week, I choked on my food twice. It's made me quite anxious about eating. We've got some tests lined up for that, so I'm hoping to get some answers.
That must be distressing. Let's also talk about your nasal bleeds and your general fatigue. How often are the bleeds, and what's your energy level like these days?
The nasal bleeds happen almost every morning. It's not a lot, but it's consistent. As for my energy, I feel drained most of the time. There are days when I barely have the strength to get out of bed, and there's this severe shaking sometimes. It just comes out of nowhere.
Thank you for sharing that. It helps me understand the full picture. And how do you feel about your current medication regimen?
To be honest, I'm not happy with it. I stopped taking metoprolol during the day because it made me feel even more tired. I only take it at night now, but I'm still not sure if it's helping as it should.
All right, I appreciate your honesty. We definitely need to review your medications thoroughly. What about your leg pain and ability to move around?
My legs feel weak, especially my calves. Just climbing the stairs has become a challenge. I've been trying to stay active, but the pain and weakness make it hard.
It's clear we have several issues to address. Let's summarize what we've covered and discuss the next steps. Your blood pressure today is 135/85 millimeter Herdrigs, and your resting heart rate is 78 beats per minute. Respiratory rate is steady at 16 breaths per minute. From the labs, your hemoglobin is at 12.7 gram deciliter, and your kidney and liver functions are within normal limits. Thyroid function is also normal with a TSH of 2.7 μIU milliliter.
What do we do next then?
Given your symptoms and concerns, here's the plan. We'll urgently refer you to a neurologist to evaluate these Parkinson-like symptoms and decide if we need to start treatment for that. Your physical medicine and rehab consultation will focus on addressing the neck pain and exploring potential treatments or therapies. The scheduled eye and swallow tests will help us tackle the recent difficulties with your vision and swallowing. To manage the postural hypotension and reduce your risk of falls, continue using assistive devices like a cane, and we'll discuss ways to manage sudden movements. We will conduct a thorough medication review to ensure that each drug is necessary and beneficial, particularly regarding the effects of metoprolol. Lastly, we'll keep monitoring your blood parameters closely, focusing on maintaining good cardiovascular and overall health.
Thank you, Doctor. It's good to know there are steps we can take. I just hope we can find some relief soon. It's been quite hard dealing with all of this.
I understand, and I'm here to support you through this process. We'll tackle these issues together and adjust our approach as needed based on how you respond to the treatments and what we find in upcoming tests. Let's set up a follow-up appointment to review everything once the consultations and tests are completed.
Sounds good. Thanks for helping me sort through all this. It's a lot, but it feels more manageable with a clear plan in place.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doc, I've been feeling pretty rough lately. This knee and hip pain are just not letting up. The tramadol helps some, but it's not like before. Plus, with all the wheezing at night, I'm just not getting good sleep. It's a mess.
I understand. That must be quite frustrating for you. Let's go through each of your symptoms to ensure we're covering all bases. How severe is the pain in your knee and hip right now?
The knee has been an issue for years, but this hip thing started a few months ago. Some days it's bearable, but other days like today, it really flares up, especially after riding with my club. I'd say it often hovers around a 6 out of 10.
And the tramadol, is it managing the pain effectively enough for you to carry on with your day-to-day activities?
Sort of, but not as well as I'd hope. I've been using it sparingly, trying not to rely on it.
You mentioned wheezing at night. How often does this happen, and does the albuterol help when you use it?
Almost every night now. The inhaler does help settle it down, but I hate having to reach for it in the middle of the night. Makes me worry about my breathing.
Let's also talk about the erectile dysfunction you mentioned. How has this affected you?
It's frustrating, Doc. I tried Levitra, but it didn't do much for me. It's another thing that's stressing me out, to be honest.
I appreciate your openness. How about your recent ear infections? Are the drops providing any relief?
Yeah, they work okay, but the infections keep coming back. It's been annoying, to say the least.
I see. You also mentioned significant weight loss. Can you tell me more about that?
After I stopped being so active with the Navy and more into the club, I put on quite a bit of weight. But over the past year, I've been trying to get back into shape, lost about 30 pounds. It's helped with my mobility, but these pains and the other stuff haven't gone away.
Well done on the weight loss. That's great progress. Now, about your smoking and chewing tobacco. Have you started the Nicorette gum we talked about?
I've been using it on and off. It helps, but quitting's tougher than I thought it would be.
Quitting is a big challenge, but you're making the right steps. Let's look at your recent lab results and radiology to understand better what's happening. Your blood pressure today is 130 80 millimeter Hg, which is within our target for you. Heart and respiration rates are normal. However, your serum creatinine has risen, which could be linked to NSAID use. Your liver enzymes are slightly elevated but stable compared to your past results. Importantly, the X-ray shows degenerative changes in your left hip, which aligns with the pain you're experiencing.
So what's the next step?
For your arthritis and hip pain, we will schedule you for physical therapy. This should help manage pain and improve mobility without immediate surgery. Given your nightly wheezing, I would recommend a pulmonary function test to evaluate your lungs more comprehensively. We'll also follow up with an ENT specialist for your recurrent ear infections.
And the pain management?
Given your history and current kidney function, we should be cautious with NSAIDs. We'll continue with tramadol for now and monitor closely. We might explore other pain management options if necessary. For your erectile dysfunction, we can consider other medications or therapies since Levitra wasn't effective.
All right, sounds like a plan.
Lastly, we should discuss lifestyle adjustments, particularly your tobacco use, which could significantly improve your respiratory issues and overall health. We'll also schedule a colonoscopy as recommended based on your age and history. I'll see you again in 4 weeks to reassess your progress unless something urgent comes up before then.
Thanks, Doc. I appreciate you helping me sort all this out.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Have you seen the latest protocols for managing pain in patients with fibromyalgia?
Yes, I have. It's great to see a multidisciplinary approach being emphasized, incorporating both pharmacologic and non-pharmacologic therapies.
Absolutely. I think including physical therapy and cognitive behavioral therapy can make a significant difference. Have you tried these methods with any of your patients yet?
I've started integrating them and the feedback has been positive. It's about tailoring the treatment to each patient's needs and responses, which can be quite varied in fibromyalgia.
Now look at question 26.
I was reviewing our protocols for handling hazardous materials in the clinic. It seems we need an update, especially with the new chemotherapy agents we're using.
That's a good point. Ensuring safety when handling these substances is crucial, not just for patient safety, but also for our staff.
Right. I think we should consider more frequent training sessions, maybe even include simulations on spill management.
Simulations are a great idea. It helps build confidence and ensures everyone knows the procedure's cold. Let's propose this at the next department meeting.
I'll draft something for our discussion. Ensuring everyone's competency in this area is essential for maintaining our safety standards.
Now look at question 27.
Have you had any experience with telehealth services for psychiatric evaluations?
Yes, I've been involved with several sessions. It's actually quite effective for many patients, providing them with the comfort of their own home.
That sounds convenient, but do you think it captures all the nuances of a face-to-face evaluation?
There are challenges, like assessing nonverbal cues is harder, but the technology has improved significantly. Plus, the accessibility can really make a difference for those in remote areas.
I see. It does seem like a good option for increasing accessibility. We might need to consider more training on this.
Now look at question 28.
Did you hear about the new guidelines for antibiotic stewardship?
Yes, I just reviewed them. They're tightening up the protocols for antibiotic usage to combat resistance.
Makes sense. It's crucial given the rise in resistant infections. Are we implementing these changes in our practice?
Absolutely, starting next week. There will be more emphasis on culture testing before prescribing and follow-ups.
It's going to be a big shift for some of our colleagues, but necessary. I'm glad we're moving in this direction for better patient outcomes.
Now look at question 29.
I've been reading about advancements in robotic surgery. It's impressive how these technologies are enhancing precision in operations.
Definitely. The precision and reduced recovery time are significant benefits. Have you had the chance to work with any of these systems?
Not yet, but I'm scheduled for a training session next month. I'm curious about how it integrates with our existing surgical protocols.
It's quite a learning curve, but well worth it. The ability to perform complex procedures with minimal incisions is a game changer for patient recovery.
Now look at question 30.
There's a new initiative on improving nutrition education among our diabetic patients. Have you looked into this?
Yes, I've started using the new guidelines in my consultations. Educating patients about their diet can dramatically improve their management of diabetes.
That's crucial. Proper diet and exercise are foundational to diabetes care. Are the new materials easy for patients to understand?
They are very user-friendly. Visual aids and simple language make it easier for patients to grasp the importance of carb counting and meal planning.
Great to hear. It's important that these educational tools are accessible. I'll start incorporating them into my sessions as well.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, we delve deep into the intricate relationship between trauma and chronic pain management, a topic gaining significant attention in both clinical and psychological fields. Our discussion is enriched by a case study from a recent Harvard review on chronic pain management in trauma survivors. First, let's define the terms. Trauma, as characterized in various scholarly articles, includes both physical and emotional injuries that might persistently influence an individual's psychological and physiological state. Chronic pain, on the other hand, refers to persistent pain that continues beyond the typical recovery period and is often resistant to most medical treatments. Now onto our case study, which centers around Jane, a 45-year-old woman who survived a severe car accident resulting in multiple physical injuries and profound psychological trauma. This accident not only left her with persistent lower back pain, but also severe post-traumatic stress disorder, PTSD. Jane's journey through the healthcare system highlights the complexities of treating chronic pain intertwined with trauma. Initially, her physical injuries were the primary focus of her treatment. However, despite surgical interventions and physical therapy, Jane's pain persisted and her mental health began to deteriorate. Recognizing the interconnected nature of her symptoms, her healthcare providers integrated a biopsychosocial approach, a model recommended by numerous Harvard studies. This model acknowledges that biological, psychological, and social factors all play a significant role in human functioning in the context of disease or illness. Jane's treatment plan was adjusted to include cognitive behavioral therapy, CBT, and mindfulness-based stress reduction, MBSR, alongside her ongoing physical therapy and pain medication. The integration of psychological therapy aimed to address the trauma and anxiety contributing to her chronic pain. Research from Harvard Medical School suggests that PTSD can alter pain perception and pain processing pathways in the brain, making patients more sensitive to pain. This aligns with Jane's experience, as she reported heightened pain on days when her psychological stress was greatest. Over the course of her treatment, Jane's pain levels were meticulously monitored alongside her psychological state. This dual-focused approach helped her healthcare team better understand the fluctuations in her pain, which were closely linked to her mental health episodes. The outcomes of this integrated treatment approach were promising. Jane reported a significant reduction in her pain levels and improved mental health over a period of 6 months. Moreover, she regained much of her previous functional abilities, returning to part-time work and resuming social activities, which had been nearly impossible for her immediately following the accident. This case study underscores the necessity of addressing both the psychological and physical aspects of pain in trauma survivors. It highlights the importance of a holistic approach in medical treatment plans, especially for patients with complex trauma histories. The learnings from Jane's case can be pivotal for healthcare professionals. They emphasize the need for a thorough assessment of trauma impacts in chronic pain patients and advocate for an integrated treatment framework that encompasses both mental and physical health interventions. By considering both the psychological and physiological dimensions of pain, healthcare providers can offer more comprehensive and effective care, ultimately leading to better patient outcomes. This approach not only alleviates physical symptoms, but also addresses the root psychological factors, facilitating a more resilient recovery trajectory.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. Today, we will delve into a comprehensive discussion on the complexities of menopause management, integrating insights from recent scholarly articles, including those from Harvard. We aim to provide a nuanced understanding of treatment options, patient experiences, and the biological underpinnings of menopause. To enrich our dialogue, I will also introduce a case study that illustrates a typical patient journey through menopause management. Menopause, as defined by the cessation of menstrual periods for 1 year, marks a significant phase in a woman's life and brings about various systemic changes due to altered hormonal levels. The average age for natural menopause is approximately 51 years, but this can vary widely. A key point to understand is the distinction between perimenopause, the transitional period leading up to menopause, and postmenopause, the stage following the cessation of menstrual cycles. One of the primary symptoms associated with menopause is vasomotor symptoms, VMS, including hot flashes and night sweats. According to a study published in the Harvard Women's Health Watch, approximately 75% of menopausal women experience hot flashes, which can significantly impact quality of life. These symptoms can last for 7 years or more in many women, emphasizing the need for effective management strategies. Turning to our case study, let's consider the experience of Jane Doe, a 52-year-old who presented with frequent hot flashes, night sweats, and associated insomnia. Jane's symptoms were typical of many midlife women experiencing perimenopause. Despite lifestyle adjustments, including dietary changes and increased physical activity, her symptoms persisted, impacting her professional and personal life. In managing Jane's case, we utilized a multidimensional approach. Initially, hormone replacement therapy, HRT, was considered. However, understanding the risks and benefits of HRT is crucial. A landmark study by the Women's Health Initiative highlighted potential risks, such as increased incidence of breast cancer and cardiovascular diseases associated with certain types of HRT. Nevertheless, recent analyses suggest that the timing of initiation and the type of hormones used significantly affect the risk profile. For women like Jane, who are within 10 years of menopause onset and under 60 years, HRT can be safely considered if there are no contraindications like a history of breast cancer or cardiovascular disease. To address the non-hormonal management of menopause, particularly for patients who prefer to avoid hormone therapy or have contraindications, options like selective serotonin reuptake inhibitors, SSRIs, or gabapentin can be effective for reducing VMS. These alternatives were discussed with Jane, providing her with multiple management options based on her preferences and medical history. Further, the role of non-pharmacological interventions cannot be overstated. Cognitive behavioral therapy, CBT, has shown promise in managing menopause-related symptoms, particularly sleep disturbances and mood swings. CBT helps patients develop coping strategies to manage their symptoms more effectively and improve their overall well-being. Another critical aspect of managing menopause is addressing vaginal atrophy and sexual dysfunction, which are commonly reported but often undertreated symptoms. Local estrogen therapy, vaginal moisturizers, and lubricants can be effective for these issues, providing relief from symptoms and improving quality of life. Managing menopause is a complex, highly individualized process that requires a comprehensive understanding of the physiological changes, symptom patterns, and available treatments. It is crucial for healthcare providers to stay informed about the latest research and tailor their approach to fit the unique needs of each patient, as demonstrated in Jane's case. By doing so, we can significantly improve the care and quality of life for women undergoing this pivotal life transition. Thank you.